Now, in this lecture, we are going to discuss topic related to dental management, and this topic related to bleeding disorders. Actually, here, as we know, any procedures in clinical dentistry, it may lead to bleeding. And this bleeding could be of minimal significance, or it is of not important, when the bleeding can be controlled easy by the local measures or even by the hemostatic mechanism of the body. It is of little significance. But sometimes when the bleeding, when there is severe or extensive bleeding, this might be of great risky and this may lead to fatal condition. The hemostatic mechanism of the body responsible for the stand-off or stop bleeding, and actually it includes three phases: the vascular phase, platelet phase, and coagulation factors or coagulation phase. Once there is injury in the blood vessel tends to constrict. This is to minimize the blood flow within the blood vessel. So after constriction of the blood vessel, the platelets can be aggregated, and the aggregation of the platelets induced by substances secreted from the injured blood vessel. There is what we call some endothelial layer. This secretes substances to facilitate aggregation of the platelets. And then the platelets themselves can be aggregated further by substances secreted from the platelets themselves. So the platelets form plug, and this is a plug to seal the injured blood vessel. Then after, the coagulation factors, which are proteins present within the blood, can be activated. And the activated coagulation factors can be participate in the formation of what we call fibrin. Fibrin support or stabilize the blood clot. So the blood clot basically is formed from aggregated platelets and also the fibrin, which is the end product of the hemostatic mechanism. The bleeding disorder, or before bleeding disorder, the bleeding disorder actually occurs, or the bleeding order occurs when there is defect or problem within the hemostatic mechanism. This defect may occur due to congenital disorder, that means the patient born with certain disorders such as hemophilia, Christmas disease, or Waldenström's, or maybe due to acquired disease such as liver disease or renal failure, or maybe due to taking certain drugs that used to increase blood flow such as antiplatelets or anticoagulants and so on. So in this case, there is some defect within the hemostatic mechanism, and this will lead to an increased bleeding or may lead to extensive or severe bleeding. So bleeding disorders can be classified into non-thrombocytopenic purples. Actually, thrombocytopenic purples, thrombocytopenia means decrease in the number of the platelets. So there is certain disorder not related to the decrease in the number of the platelets. Platelets, actually, this is the cells of the blood called megakaryocytes. So decrease in the number called the thrombocytopenia. The classification of the bleeding disorder might be not related to the number or decrease in the number of the platelets. These are such as vascular wall changes, which usually seen in case of immune disease. So there is fragility or there is some disorder or some defect within the vascular wall, and this will lead to bleeding. Disorder of platelet function, there is the quality of the platelets. So there is no aggregation, and also this will lead to bleeding. Or could be thrombocytopenic purpose related to the decrease in the number of the platelets. And this could be of primary, of unknown reason, or what we call idiopathic, or could be secondary due to exposure to chemicals, radiation, or due to malignant condition of the bone marrow called leukemia, in which there is increase in the immature white BC at the expense of the production of platelets, RBC, or white BC. There is another type of bleeding disorder related to coagulation disorder or coagulations or coagulation factors. As I mentioned, could be inherited or congenital, such as hemophilia or Christmas disease, or even Waldenström's, or could be acquired due to liver disease, because some of the coagulation factors can be synthesized in the liver, such as factor 2 or factor 7 or factor 5 or factor 9. These can be synthesized in the liver. So any disease within the liver may lead to bleeding disorder, or could be due to renal disorder or renal failure, or could be related to vitamin deficiency and anticoagulants drug. What are the signs and symptoms of patient with bleeding disorder? The patient may be, or the clinical manifestation, present with ecchymosis, which is pinpoint bleeding, or petechia, according to the size, can be classified into ecchymosis or petechia. Hemoerythrosis, bleeding within joints, particularly weight-bearing joints. Weight-bearing joints, that means the knee joints or the ankle joints. This is because of the movement, there is minor trauma, and due to fragility of the wall of the blood vessel, this will lead to bleeding within the joint, and this is called hemoerythrosis. Epistaxis, that means bleeding from the nose. Gingival ulceration, this is actually oral manifestation. Gingival bleeding or gingival ulceration, or even gingival hypertrophy. Here we can see this is the types of petechia, ecchymosis, and also purpura. We can see ecchymosis should be more than 1 to 2 centimeter, purpura more than 3 millimeter in diameter, and petechia 1 to 2 millimeter in diameter. This is periorbital ecchymosis, or what we call raccoon sign. This could be due to trauma or could be due to what we call bleeding disorder. Medical treatment of bleeding disorder include, or this is actually the responsibility of hematologist. It is not the responsibility of the dentist. And the treatment, it could be according to the type, whether there is congenital deficiency of one of the factors, or could be due to decrease in the number of the platelets, thrombocytopenia, or could be for another reason and the severity of the condition. The laboratory test including prothrombin time, actually this measures the extrinsic pathway and the common pathways. This is derived from actually the coagulation factors present within blood as protein can be activated by extrinsic or intrinsic factor. Extrinsic, that means by substances secreted from the injured tissue. So activate, for example, activation of factor 7. So this is prothrombin time measures the extrinsic pathway and the common pathway. The measurement should be from 11 to 15 seconds. Activated partial thromboplastin time, should be from 25 to 35 seconds, and this is measured the intrinsic and the common pathway. Actually, certain coagulation factors such as factor 8 can be activated by contact with the subendothelial layer. During injury of the blood vessel, there is exposure of the subendothelial layer of the blood vessel, and during contact this activated factor 8, for example. Bleeding time, actually this is measures the function of the platelets as well as the condition of the vascular wall, and measures from 1 to 6 minutes. This is most common used and more relevant. We can do also investigation of the whole of the blood, and particularly the number or the count of the platelets, which is in the normal condition counting from 140,000 to 400,000 per cubic millimeter. Actually, this number is very important of the platelets because there is certain condition. For example, in case of regional block, I mean the local anesthetic technique, block technique, in this case we need, for example, 30,000 per cubic millimeter of the platelets. In case of minor operation, for example, tooth extraction, we need at least 50,000 per cubic millimeter of the platelets, and in case of the major procedures, we need more than or 75,000 per cubic millimeter of the platelets. So this is very important. Now, dental management of patients with hemophilia. So what is hemophilia? Basically, hemophilia, it is one of the bleeding disorder. It is congenital, that the patient born with this disease. And this is due to or characterized by deficiency of factor 8, one of the coagulation factors within blood. Hemophilia can be classified into hemophilia A and hemophilia B. Hemophilia A characterized by deficiency in factor 8, while